Hello Facebook Live. This is Dr. Bill Bird, and yes, I am being recorded rather than being live. We had some technical difficulties. Sorry about that. So what we're going to do is answer the questions that we have. Unfortunately, we have a good number of them that came in during the week, and then you'll see this having been posted rather than live, and we'll try to get our technical difficulties worked out so that I think we're going to try to do a weekly update, and so next week when we do this, hopefully we'll be able to do the live thing again. So, I forgot to go ahead and introduce yourself.
I'm the same person that I was, Sandy Westbo from the Infection Control Department here at the hospital.
Okay, sorry about that.
You have to have some sense of humor.
And then we have, I don't know if you caught us last time, we're trying to socially distance more than we were last time. We kind of have the camera a little different so that we can be a little further apart. So, first question, let's get at it. How long is the recommendation for isolation if possible exposure? And if you do test positive, do you quarantine from the day you test or from the day you showed symptoms? And how long is the quarantine if positive? So Sandy's more of an expert on those questions. I'm going to let her have a go at those.
So public health would direct that if a person was positive, they would be isolated in their home for at least 7 days. It would be from the time of onset of symptoms or from the time of the test date if that wasn't clear. And you would need to be fever-free without any kind of medication to reduce fever for at least 3 days. So the other one gets a little bit more complicated. If you're a household member of a person who is a positive case, your quarantine period is a little bit longer. It's at least 14 days because you will have had continued exposure to that individual during the time they were infectious. So that's kind of the short of it.
We'll take it. Thanks, Sandy. Yeah, is it safe to use items that were shipped from China? Yeah, I wondered that too, but from what I've read, it's okay. It's okay to use items that were shipped from China. How many cases do we have in Whiteside County? So the tally at the moment, hot off the press, is 132 tests have been done, 49 have been negative, and 1 has been positive so far. So that's kind of where we stand, and the part about that, if you do those numbers, is that means we have 82 tests that we're still waiting on. So that's the part that I wish I could give you answers on right now. All right. How could there be only one confirmed case in Whiteside County? Statistically, that just seems odd that one person did not spread it to anyone else. Okay. Sandy, what do you think about that question?
So any confirmed cases, the county health department would follow up with that individual and do some what they call contact tracing on any contacts. We're not saying that there's only one case in the county. We're saying one confirmed that's been tested positive. So there certainly could be people out there that are positive that at this point we don't know. People that have mild disease that haven't presented for medical care or testing, which is the recommendation, but one confirmed laboratory tested individual.
Yeah, so you have this bucket of people that, have had mild or maybe even they don't feel a whole lot of symptoms at all. And so that's why we wouldn't necessarily have more than one, even if we've had a case that's been confirmed. If the number of cases keeps going up in Chicago and not here, does that mean sheltering in place is working, or does it mean it really just isn't here yet and we're sheltering too soon? Yeah, that's a good question. I'm not sure that I have a for sure answer for that. I would say that it's probably not just one thing that's helping to try to keep our numbers down here in Whiteside County. Sheltering in place definitely does not hurt. So you think about all the crowdsourced kind of situations that go on in a typical week. You look at the paper, you look on Facebook at all the events going on, and think about all the opportunities for people to gather together and share their viruses together that are not taking place right now. So I can't help but think that there's some value in that. Now, the whole timing of it in terms of it being in Chicago and how robust will there be a spread out here in more rural counties, I don't know that we have an answer for that. Sandy, you want to add anything else to that?
I think we don't know. It's too soon to tell. But if you look at other places that did sheltering in place early, it seemed that their cases were less. Chicago, I do want to bring up that area. It's a highly populated area, and sheltering in place was not happening, at least up until yesterday. Ideally, they had people crowding to the beach, to the lakefront, to the parks, to the walking paths. So I think as long as that continues happening, they will still see community spread. So hopefully, it sure looks like it when you drive through town that people here are practicing what we're asking them to do.
Sandy, I think if I remember right, from the time you're exposed to the time you might have symptoms, is it like potentially up to 8 days, something like that?
It can be up to 14, but most people become infected at around day 5, or symptomatic at about day 5 is the median.
Yeah, so I asked that question because now we have been in this kind of plan, this pattern for, gosh, when did we start that?
I don't know, is it a week where everything kind of shut down?
Every day it just all kind of blurs together, doesn't it? But it seems like it's been about a week or so. So every day that goes by that we don't have a positive case out here would at least add some weight in my mind to the fact that having fewer of us being around other people seems to be a good fit. I mean, it seems to make sense from my standpoint clinically. Okay. Okay, I wasn't quite following that. Okay, sorry. Back on track here. Next question. Should my husband still be going to therapy? So I'm assuming that's like physical therapy, rehab. Yeah. So here's the deal on that. This kind of flows into what we're telling all of our medical staff and rehab staff. So we are not having patients come in for elective problems. So when I say elective, so let's go to rehab for therapy. So if someone has just had a knee replacement surgery and the outcome of that surgery is going to be dependent upon seeing a physical therapist on a regular basis for a period of 2 or 3 months, then we're going to ask that patient to come in because we want to make sure they get a good outcome. And if they didn't come in, they could have a poor outcome from their surgery. If someone is needing to go to rehab because they just sprained their ankle, then that may be something that we would kind of weigh and say, well, you know what, even though it would be really good if they went to therapy, it's probably going to be okay if they're not going to therapy right now with that. So all of our medical staff and our rehab staff as well are doing this on a case-by-case basis. They're looking at the patients that they have on their schedules, and they are having conversations with themselves and then getting a hold of the patients and saying, hey, I think it'd be good if you still came in, or I don't think it would be a good fit if you came in, because we're trying to reduce the patient's risk for exposure to any virus. In other words, more social distancing. So that's kind of a long answer to that short question. Sandy, anything you wanted to add to that?
So just, you can feel confident that we're doing everything possible in our facility, including the therapy department. We are cleaning those areas adequately with disinfectants that will kill that virus. And if you're in a waiting area, the chairs are spaced apart far enough so that you should not be concerned about that.
Yeah. There are 2 questions I'm going to put together, okay? So you don't get to choose. I'm telling you, we're going to put those together. Okay, so here we go. All right, so why aren't you able to do testing anymore, and why isn't CGH doing drive-through testing like other places? So I'm going to take a crack at it, and then I'll let you kind of add on to that, Sandy. So we are still doing testing. We're doing targeted testing on basically the sickest patients that show up to see us. So for sure, if you come to CGH and get admitted to the hospital, we're going to test you. And then if you come to the emergency department or ready care and you fit into some of the real high risk kind of buckets, then there's a chance we might test you. And then beyond that though, We are not testing you. And I would love to test everybody that came in. But here's the deal. Right now, and I'm just saying this is where we're at. We don't have enough tests. We don't have enough test kits to run to get results in a timely manner. And so that's just where we're at. And that's going to change in 1, 2, 3, 4 weeks. Somewhere in the next month, that's going to change. But until then, having the test run on the sickest patients is top priority. Because, like right now, for our hospital patients, it's 2 or 3 days to get a turnaround to get the test back. And during that period of time, we're having to use PPE, personal protective equipment, on those patients because we don't know the answer to whether they're positive or not, or negative. And so we use a lot of PPE just waiting. For our outpatients, we use, that we're doing testing on, it's taking, I think, the last 7 to 8 days, 6 to 8 days, something like that, to get results back. And I know that's really frustrating. So the deal is this, the less we gum up the system with people who could just be at home and who have mild and moderate symptoms, for now at least, the more quickly we can get turnaround on patients who are really sick and are in the hospital and save the PPE that you keep hearing about from big cities where they're struggling with their PPE. We want to have the PPE should we have a surge here. And so that's why we're doing testing on inpatients. That's why we are recommending against drive-up testing, because all that does is it plugs up the system for tests for people who really need it right now. Sandy?
Nope, I'm good.
Okay. Would it be wise to get the pneumonia vaccination? What would you say about that, Sandy?
Anyone who should be getting it should be getting it. Just as a matter of, we would always tell you, yes, any vaccine preventable illnesses that you can avail yourself to, you should.
Yeah, yeah. And just as just something that I find encouraging, because for this COVID-19 virus, the fix for this is an immunization, is either an immunization or a medication that we know works for it, neither of which we have right now. But I will tell you, I saw that there are 14 companies actively working on trying to develop an immunization for COVID-19. And the other thing about this virus that looks encouraging in terms of in developing an immunization is it doesn't seem like it's mutating too much. And so because it's not mutating too much as it goes through the population, throughout the world, that I'm told by these really smart people that do that figure out how to come up with an immunization, that means that they can come up with one and they can target what they want to do easier. And it could be you just get one immunization for this and you're done. Not like influenza, where every year the virus is changing, and so we try to guess as best we can what shot we need, what immunization, and what we need to have for you for that year. Anything else you want to add about that, Sandy?
No.
Okay. Why would I be told to not keep my appointment with my doctor? If I don't, I won't receive new prescriptions for my medication. So, once again, it goes to what we're trying to do. We're trying to protect our patients from, if you don't really need to be here, then we're trying to keep you out of here. So that is part of that, is that our docs are looking at their list, and if they have someone who's due for a 6-month appointment to recheck some of their chronic medical problems, we're telling them, I think it'd be reasonable to push that patient back a little bit so that they can stay home and socially distance and reduce their risk of getting COVID-19. And as to the part about your prescriptions, what we're recommending to our medical staff and what they're doing is, if they are going to push your appointment back, they'll also give you enough medication to last until the time of your upcoming appointment. As of right now, our tentative plan is that April 13th, that we would begin doing elective procedures, elective office visits, and those type of things again. That's our tentative plan. That depends upon what the Illinois Department of Public Health and Governor and on other folks outside of CGH would say about all that. But that's kind of our what we're planning on. and we shall see. And I apologize for those of you who had appointments that were like from, I think, April 1st or 2nd through the 13th that we had to reschedule. I really apologize. We do not want to do that, but we're just trying to keep folks safe and trying to do the right thing. Okay, what else do I have? Everyone says to not go to the emergency room if I have a fever or cough. What if I'm having an emergency health situation, but I have a fever? What would you say about that, Sandy?
Well, we would ask that you phone in ahead of time and give them an idea that you're coming so that we could properly protect you and the staff from, maybe a potential infection.
Yeah.
But we're not telling people who need to come to the emergency room, certainly not. If it's an emergency issue, you would still seek medical care.
Yeah, that hasn't changed. So if you feel like you have an emergency, that's what the emergency room is for. But let me talk through the process of what we're asking our patients to do. Again, just to make sure I can be clear on this. So what we are asking is if you have some symptoms that are concerning to you, we ask that you would first call your primary care physician, their office, and have a conversation with them. A lot of times this can be your symptoms, they can be triaged over the phone and taken care of. Your primary care physician in that course of that conversation may recommend that you go to our Ready Care, which is where we see folks that we have a little more concern about. And or if they hear your symptoms and go, this is a little more than just, this may be more than mild or moderate symptoms, they may send you to the emergency department. But I ask that you would use our primary care, your own primary care provider as kind of that source of, this is where I'm going to start talking through this process. If you have general questions about, more questions about COVID or those type of things, there is an 800 number through the health department, and I don't have that at the tip of my tongue. We had that last.
It's posted on our website.
Yeah, well, it's posted on our website, so you can look that up at our website, and there's a number that you can call for just more general questions. Anything else you'd say about that, Sandy?
No.
Okay. What about seasonal allergies that are starting up, or influenza that's been going on around for several months? How do I know the difference? Oh, hey, before I answer that question, I'm going to re-answer another question that we already had. So one of the things that we are beginning to roll out here at CGH is some televisits. So we had, I think it was yesterday, we had 11 docs, our medical staff that went online with doing televisits via Zoom. And I think we have another 12 today that are going live with that. So we are trying to respond to the need of some of you to have conversations with your physicians in a face-to-face type way with these televisits. So I'm not guaranteeing that your primary care provider is doing televisits, but there's a chance they might be. And I don't know if we have, on the marketing side, have we kind of posted who's doing that yet? Okay, we might do that. Yeah, that might be something that we can do, so you can kind of look on our Facebook page and see who's doing televisits, and you can request those. But that is definitely something that we're also adding to try to meet that need of, hey, I need to have a conversation, and ideally a face-to-face one with my provider. So back to the other question I just asked. What about seasonal allergies and starting up influenza that's been going around for several months? How do I know the difference? Sandy, you want to take a crack at that?
Well, first of all, the good news is finally the influenza seems to be decreasing at this point in time, which we're thankful for.
Yeah.
But it is true that early in the coronavirus that your symptoms may mimic influenza. So you maybe don't know. And so again, if you have high-risk situations, some discussions with your provider would be helpful in a situation like that.
Yeah.
Same with the allergy question.
Yeah, that's a good one. Allergies in general for this person who probably has seasonal allergies, I think you're going to feel a difference in that you're going to have the watery eyes, the runny nose, the sneezing. And you probably, if you take a Claritin, you're going to feel better. Whereas if you had if you have some virus like this COVID-19, I don't think a Claritin's going to make a hill of beans in terms of how you feel. So to me, that's kind of some stuff too. You take the allergy medicine, you feel better. You're probably dealing with allergies because there's still way more people that have allergies than have COVID. At least probably by the time April hits, right? It depends how early the spring is. Hope I answered that one reasonably well. If no testing is being done, how do we know the death rate compared to the survival rate? South Korea did thousands of tests per day. Great point, and you are correct. So without having as many tests as we want to do on as many patients as we want to do, we know how many people are dying from this. We don't know exactly how many people have it. So as you plug and chug the numbers of what percentage of folks who get this pass away from it, it is a little bit of a moving target, and I think it's going to take some time for that to all sort itself out. What I will tell you is that for the people that are positive in the state of Illinois, and I wrote this down somewhere, 1,865 people as of yesterday were positive, 19 deaths, about 1% was the mortality rate. But yeah, it definitely, I would feel comfortable in saying that rate may be lower than that because you have more people who actually are positive who just haven't been tested yet, who are at home and hanging out, and they have mild or moderate symptoms. Sandy, I'll let you talk about
I think, that'll be for the statisticians to figure out probably in the next 6 months to a year,
Yeah.
looking at all the countries and sorting that out.
Yeah. What it doesn't change is the fact that you have certain pockets in our country in certain cities right now, of course New York, Seattle, Chicago, where irregardless of what percentage of patients actually have it, we definitely know that there are some really sick people from this infection. So that is irrefutable, if you will. Okay, FDA just approved a COVID-19 test that results can be obtained in 45 minutes. Waiting 4 more days for results is scary. Is the test available locally? Yeah, they did approve it. I agree with you that waiting 4 more days for test results is frustrating, and and it's filled with anxiety for I'm sure patients as well as our staff. Absolutely. When we can get 45 minute turnaround testing here, it will be a game changer for us and for our patients that we serve. Is that test available locally? No, not right now. I'd like to say that we're going to have it in a certain date, but I don't want to say that. We will have it. I just don't know when. And I think it's fair that if those tests are available and they can get those tests out, they need to go to the hot spots. And so they need to go to New York, they need to go to Chicago, they need to go to Seattle, and make sure that they're loaded up and they have plenty of those first. And then we'll get them too. But I don't know if you'd add that to that.
There's actually 2 tests available that the FDA has approved now that gives you a rapid turnaround time. And our lab director is working with both of those companies to in an effort to at some point secure that test for our facility.
Mm-hmm. But definitely one of the mitigation ways of controlling this that some countries have done a really nice job of is, you test a patient if they want to be tested or if they have symptoms, and then if they're positive, you quarantine them, and then all their contacts you get a hold of and you test them, and if they're positive you quarantine them, and that's really effective. And 100% agree with that. It's just right now the reality of where we're at, we have scarce resources and we're doing the best we can with the resources that we have and making the most of the tests that we have. Because kind of our mantra to our team around here is, we right now have had 1 positive case, and right now PPE wise we're making a go of it, and yet though we want to not just assume that we're going to be able to keep making a go of it. We want to be thinking like we could have a surge, so we have enough equipment when that happens. So that's what I would say about that. Let's see what else I have here. What could the community do to help? Are you accepting donations? So there's going to be a blood drive April 2nd, And you can look at that up on our Facebook page as well. This is one where they're not wanting walk-ins so much. They want you to schedule that in advance for obvious reasons. But I sure would appreciate that to get to have as many of you as are able to give blood that would. I think if you're 80 or older, you're not a go for that. And then donation-wise, we definitely have certain things that we would very much appreciate being donated. And I just want to thank those businesses that have donated equipment to us. There's a certain type of N95 face mask called an NIOSH that we would love to have more of. I guess I would say that there are some things, and so what would be most helpful for us is if you would look at our Facebook page and or our website. What do you have for us, Dana? Okay. Donate materials. This is what you look at. Donate materials at cghmc.com. That's donate materials at cghmc.com. And that'll give you more information about that. Thanks, Dana. What's the next question? Okay. Do you have a test for flu A and flu B before COVID-19 is indicated? What do you think about that, Sandy?
You don't have to test for influenza prior to, but our practice has been to go ahead and do that, because if you have already another diagnostic explanation for the symptoms, then you may not move into testing for coronavirus.
Okay, yeah. So it's less of an issue as time is going by because influenza is starting to die down. But yeah, we were doing that because if you were positive for influenza, there's about a 5%. I think I've heard that 5% of people who have influenza may have COVID as well. But it made us feel a lot better that the patient probably didn't have COVID if they were positive for flu. Let's see here. What are the 43 people in Dixon presenting with that come back? Negative? I don't know. I think the same thing is around here. There are a lot of more negatives that are coming back than positives. What is CGH capacity for ventilators? So we are working on that right now. We have 5 ventilators in our ICU. We have also worked on contingency plans to use some of the ventilators that we have in our ORs. So we have another 5 ventilators that we could put in play for a total of 10 ventilators very easily for patients. So I feel pretty good about where we're at with that right now. There are other scenarios that we're thinking through, but for now, that's where we're at in terms of our ventilators. And then, what else did I want to see? Oh yeah, and I want to just talk about some of the things we're trying to do to conserve PPEs around here. So you want to talk a little bit about like what we're trying to do for disinfecting N95 masks, Sandy?
First, I want to clarify, because we like to use abbreviations and lingo that you may not be familiar with.
Yep, our bad.
So PPE is personal protective equipment. It's the gowns, the masks, the gloves, the goggles that our healthcare workers use when they go into rooms of patients who have potentially infectious diseases. So because masks are a short supply, we've done some unique things with our ultraviolet machines where we're able to decontaminate the masks that healthcare workers use. They're assigned to one healthcare user, and they can be decontaminated up to 5 times, so that will help preserve the supply. We have tried to limit the number of healthcare workers who go into the patient rooms so that we don't use up our supply of personal protective equipment. What
As a matter of
else?
fact, we're working on something for our physicians. So some of them are going into the rooms. We're working on some work with some monitors that allow them to have conversations with patients who are suspect COVID patients without having to go into the rooms, which preserves some of the PPE, which Sandy's already defined there. So we don't have to use as much of that when they don't go into the room. They'll still go in the room sometimes, but it does give us, once again, we're just trying to think of everything we possibly can to make sure that we're conserving and using what we have wisely. Do you want to say something else, Sandy, or?
No, I just
Okay.
have a new question coming up here
Okay.
through the queue.
Oh, through the queue. What do you got?
How are you protecting your frontline cleaning staff that go in and clean patient rooms in the entire hospital? what steps have been taken by the hospital to ensure their health, safety, and well-being. I'm assuming that you're talking about going into the patient rooms that we are testing for coronavirus. So we've made the decision as part of our limiting people going into the rooms that the staff, the nursing staff, will clean the rooms and keep the rooms clean during the patient's stay. The housekeeping staff will go in once the patient has been discharged. So we'll leave that room empty for 2 hours so that the air can exchange totally in that room, and the housekeepers then no longer need to wear a mask because the virus is not circulating in the air at that point in time. And so then at that point they use their regular gowns and gloves and disinfect the room like they would any other room.
Yeah. So we're following all the, I'm telling you, Sandy scours and makes checks, double checks, triple checks to make sure that we're following all the IDPH, Illinois Department of Public Health, and Center for Disease Control, CDC guidelines for our staff, to make sure that they're doing it in a way that is safe and be able to take care of our patients. Good question. So what else do I have? Okay, are we seeing patients from nursing homes that are being tested, and do they stay or go back to the nursing home? Sandy, what would you say about that?
Yes, we are seeing patients from the nursing home that we have tested, and we are more vigilant with those individuals, and the symptoms maybe don't have to be quite as severe, I guess I would say, as other patients. We have a high level of suspicion for those patients because you would not want to have someone in a group setting that had coronavirus and send them back at that point in time. So we're in communication with the public health department again, and we would wait for the testing to come back. That's not to say that every person that comes here from a nursing home is tested. If they're not symptomatic at all, if they're coming for something else like a urinary tract infection, they wouldn't be tested, but absolutely they're part of the population that would be tested.
Yeah. Yep. Okay. I have a few other random things I want to talk about, and feel free to kind of segue on these things that I mentioned here, Sandy. So just some things that are being done to try to help out patients who are really sick, that are kind of some outside the box type of things. I know the FDA has approved that we can pull plasma from recovered patients and use that plasma because basically if you have an infection, you develop antibodies. It helps you to fight off that infection. And so they're, for really, really sick patients, they're letting, particularly out east, I'm understanding, and maybe even Northwestern, I'm not sure, but they're letting medical staff take the blood, the plasma from recovered patients and infusing it into the sick. Hello? That's worth a try. What are your thoughts on that?
So we wouldn't be offering that here at this point?
No.
Just want to clarify that.
Yeah. No, I'm just kind of throwing out some things that are happening. It's not that, you never know, but I'm just saying
down the road.
Yeah, you never know. It just makes, I've been thinking about this, like in terms of something like this, I guarantee you that across the country, across the world, the smartest people are trying their best to, with the information they have, to make the best possible decisions they can. And 20 years from now, we'll look back and go, what were we doing there? Why did we do that? Why were we thinking this? It's just, I was just thinking about that it used to be every 100 years or so, you'd look back and go, why were we doing that 100 years ago? I think the speed of that is kind of getting more rapid now in terms of how science is moving and evolving, that things that we thought made sense are, at some point in time don't make sense anymore, but all we can do is act upon the information we have and try our very best with the information we have to make good decisions. And that, I guarantee you, is what we're trying to do here at CGH. And one other plug, when I thought about that, it made me think about how important it is for maybe if there are kids watching this, students of any type, if you have an interest in math or science, man, pursue it. Because the folks that are doing that kind of stuff are the folks that are developing the immunizations. and helping to think through, like, how do we better disinfect things? What do we need to do in terms of trying to better know when another COVID comes up, and how do we get testing, and how do we do testing more quickly, and how do we develop those tests? A lot of really interesting questions, that need to be answered. And so we need people to do that. And so, hey, if you're out there and you're a student and you have an interest in that kind of stuff, go for it. Go for it. Give it a try. So, not that it's not okay to be an English major. Not saying that at all, because my gosh, the world needs that as well. But if you have an inkling, don't write that off as a possibility. What else did I want to just go on about? Let's see here. It's interesting, as we've the questions have alluded to this, that right now, if you look at the state of Illinois, that if you live in a county that has just 2-lane roads, your number right now is either 0 or single digits in terms of cases. I don't know if that's going to hold up. I think that's interesting. And I guess what I think about that is for folks in rural areas, there's a little bit of social distancing that kind of naturally happens just because of where our population is not as dense. And then you throw in, if you don't have the basketball games that people go to, or church, or bars, or all these kind of places where people would congregate and spread and share their viruses and germs. Yeah, I mean, pretty effective in these areas. One of my theories too was, I don't know if John Deere green is antiviral or if manure is, I don't know, but whatever. Right now, I'm thankful for that, but we have to remain vigilant, and we will continue to remain vigilant that we could be next in terms of that. Comments about John Deere green, Sandy?
No.
Okay.
No comments there.
All right. Hey, I wanted to one other item I just wanted to be clear about. I noticed this. I got a health lines from CGH in my mailbox within the last couple days, and it has our ophthalmology department and what we do in terms of the ophthalmology department. We're not insensitive to COVID with our health lines. It's just it got printed before this all kicked off, and so it was already mailed. So those of you who are getting this and going, why isn't COVID in the health lines? Yeah, that's why. There's nothing nefarious on our part that we're trying to not talk about it. That's why we're talking now. And that's why we're going to keep talking about this. And we're going to be back next week to talk about this some more. And what else did I want to say? Anything else you wanted to add, Sandy? Because I like to add. So I'm going to add also, what else do I want to say about this? We'll be back next week. And we're going to have an opportunity for you to ask more questions. And so be looking at Facebook Live, and we'll try to be live next time as far as this goes. And so final thought I would just leave you with is, for something like this, for this pandemic, obviously we need science and we need education, and that's part of why we're doing here, so that you get the information you need to feel more comfortable about what's going on with COVID and what's going on around you as far as that goes. And we definitely want to keep doing that. But the other thought that crossed my mind, there's a lot of anxiety and fear about this. And I hope this helps, just to have this, this Facebook Live conversation. But I think too, if we think too, also this is an opportunity to realize that love is greater than anxiety or fear. And so what I would encourage you is just, that's a thought I'd like to leave you with. And I'd encourage you to, reach out to I think one of the things I've been doing is, like, when I go home from work, on my way home, I'm getting a little teary-eyed here. What I'll do is I'll try to reach out and call mom and dad, or call one of my sisters, or take this opportunity when you have some time to reach out and tell your friends and family how much you appreciate them, how much you love them. We're going to sign out for this week.
See you next week.
All right, bye.